10 Natural Remedies for Ingrown Toenails. Ingrown toenails result in discomfort, erythema, and edema. Both natural treatments and professional care can ease symptoms and stop further infections. For those who wear shoes that are excessively tight or prevent their feet from breathing, ingrown toenails are a common issue. An ingrown toenail occurs in approximately 20% of people at some point in their lives. An ingrown toenail can cause pain and toe swelling as symptoms. The nail may occasionally get infected. Ingrown toenails can be treated in a variety of ways, from at-home cures to surgery. Most of the time, home remedies or over-the-counter medications can be used to cure an ingrown toenail. However, you might need to contact a doctor for treatment if the nail is infected or causing excruciating pain. What causes ingrown toenails? When your toenail's corner or edge curves and grows into the nearby skin, you have an ingrown toenail. Pain, redness, and swelling could result from this. Both men and women suffer from the illness rather frequently. The most probable toe to be impacted is your big toe. Ingrown toenails can result from the following: injury to the toenail, such as stubbing your toe when wearing too tight shoes, cutting your toenails too short, etc. Improper foot care. Excessive perspiration, hyperhidrosis. A few drugs, like inhibitors of the epidermal growth factor receptor. Ingrown toenails should be treated as soon as they appear to avoid infection. Mild conditions might only need a little home care. Surgery may be required in severe situations. 10 typical treatments for ingrown toenails. The following remedies can assist in easing discomfort and accelerating the healing of an ingrown toenail. 1. Soak in warm water with soap. Soaking the hurt foot could help with pain relief and edema reduction. For up to 20 minutes at a time, you can bathe your foot in warm, soapy water. Another choice is Castile soap. Epsom salts in the water could provide additional comfort. 2. Use apple cider vinegar to soak. These days, ingrown toenails are one of the many ailments for which apple cider vinegar is used as a folk remedy. Although there is little scientific proof, it is thought to have antiseptic, anti-inflammatory, and pain-relieving properties. Prepare a basin with warm water and 1/4 cup apple cider vinegar to test this cure. Each day, soak the troubled foot for up to 20 minutes. After soaking, properly dry your foot. 3. Cover the area with cotton or dental floss. To promote healthy nail growth, some experts advise placing tiny pieces of cotton or wax dental floss beneath the edge of an ingrown toenail. Not all medical associations concur. The American College of Foot and Ankle Surgeons warns that putting cotton beneath your nail could make it more painful and promote the growth of dangerous bacteria. Before use, soaking the cotton or floss in alcohol may assist to lower this danger. 4. Use an antiseptic cream. Using a lotion or ointment with an over-the-counter antiseptic. It can encourage recovery and assist in lowering the risk of infection. As directed by the manufacturer, apply the ointment to the troublesome toenail up to 3 times each day. These ointments may consist of mupirocin, bacitracin polymyxin B, polysporin, and neomycin, neosporin, Bactroban. After application, be sure to bandage the toenail. 5. Put on cozy footwear and socks. Your toes may be crowded by shoes and socks that are excessively tight. Ingrown toenails are frequently caused by improper footwear. Wear shoes and socks or hosiery that fit comfortably while still leaving enough room in the toe bed to avoid an ingrown toenail from forming or getting worse. Avoid wearing shoes or sandals as much as you can during the healing period to lessen pressure on your toenails. 6. Use a non-prescription painkiller. Pain from an ingrown toenail may be reduced with acetaminophen, Tylenol. Unless you take more than the daily suggested dosage of 2 325 mg/mg tablets every 4 to 6 hours, side effects are uncommon. Don't take it with alcohol and don't take more than 10 tablets in a day. Ibuprofen, Advil, which reduces both pain and edema, can be a preferable choice if there is swelling. Ibuprofen's typical adverse effects include diarrhea, upset stomach, and pain in the abdomen. All over-the-counter painkillers should be taken as prescribed by a doctor or the manufacturer. 7. Put on toe guards. For ingrown toenails, a toe protector offers a cushioning barrier. Toe protectors can be purchased as full toe covers or as rings that fit around the injured area. Some toe guard manufacturers, including Dr. Scholl's, include a medicated gel to help soften toenails for simple trimming. Follow the treatment instructions until the ingrown toenail has disappeared. 8. Examine a toe brace. Toe braces are flimsy composite devices that hold the toe in place and protect the skin while a new nail grows in. They aid in the treatment and avoidance of ingrown toenails. Toe braces are available online and in some pharmacies. 9. Consult a physician regarding oral antibiotics. Oral antibiotics may be recommended by your doctor. Dependable source for severe ingrown toenail infections that don't improve with other cures and treatments. Oral antibiotics fight infection while also reducing inflammation and pain. Infection symptoms may include heightened redness and pain. The affected toe and its surroundings have increased swelling, pus, and warmth. Bad odor. Ampicillin, Omnipen, amoxicillin, Amoxil, Moxitag, and vancomycin are a few antibiotics that are used to treat infected ingrown toenails, vancomycin. 10. Take into account nail removal. Partial or complete nail removal may be required if home cures for an ingrown toenail are unsuccessful. A doctor might cut away a portion of the central growth plate, the nail bed underneath, or the nail border using local anesthesia. The doctor may advise removing the entire ingrown nail in severe, recurrent cases. This is a desperate measure that could be uncomfortable and raise your risk of infection. Additionally, it raises the possibility of a misshaped toenail as it regrows. When to visit a doctor. Ingrown toenails and other seemingly unimportant foot issues might in some cases lead to major difficulties. If you have diabetes, another condition that impairs circulation, a weakened immune system, or an ingrown toenail, see a doctor very once. Additionally, you must visit a physician if you have severe pain and swelling, a skin allergy to a home remedy, concerns about how to treat an ingrown toenail, and home remedies don't improve the situation. Outlook and prevention. The majority of ingrown toenails are not harmful. With the right home care, they should get better in a week or so without inflicting any lasting harm. Ingrown toenails may result in excruciating pain and an infection that may spread to deeper skin layers if left untreated. It's typical for ingrown toenails to recur, especially if you don't take precautions to prevent them. Prevention tips. To prevent toenail trauma, move with caution. Your toenails should be cut straight across and no shorter than the toe's tip. Wear protective footgear if your job increases your risk of toenail damage. Takeaway. Although ingrown toenails might be uncomfortable, they are typically simple to treat at home. Ingrown toenails can be avoided by wearing shoes that fit properly, trimming your nails straight across, and soaking your feet. Usually, ingrown toenails disappear without causing any lasting harm. However, they occasionally cause major problems. If you have a medical issue that puts you at risk for complications, such as diabetes, consult your doctor. If you like the video, give it a thumbs up and share it with your friends. If you want more recipes and tips, subscribe to the channel.